Rahim. Assalamu alaikum. I am here from Conceptual Medicos, and today in this series of lectures we will be talking about the diuretics. So diuretics are the drugs which promotes the excretion of the sodium and water. Before going to the diuretics, let's review the physiology and anatomy of the nephron. As we know that nephron is the basic structural and functional unit of the kidney, and each kidney contains about 1 million nephron. So there are about 2 million nephrons in a human being. Coming to the different parts of the nephron, so this is the glomerulus network of capillaries from which the blood will filter to the Bowman capsule, and then from the Bowman capsule the blood will pass through these different tubules. The first part is the proximal convoluted tubule. Most of the substances are absorbed from this part. Then we have the loop of Henle. The loop of Henle is further divided into two parts, the descending loop of Henle and ascending loop of Henle. So the descending loop of Henle only this is permeable to water, and only water will be absorbed from this limb. Then the ascending loop of Henle is divided into two parts, the thin ascending limb and the thick ascending limb. The thin ascending limb is permeable to water and some sodium and chloride. The thick ascending limb has many channels which will be discussed later, and permeable to sodium, chloride, potassium, magnesium and calcium. Then we have the distal convoluted tubule and then the collecting duct, and at this stage the urine is formed and goes through this way. And now we will discuss three different sites where the diuretics mainly work. So the first one is the proximal convoluted tubule, where the carbonic anhydrase inhibitors work. The second one is the thick ascending loop of Henle, where the loop diuretic works. And the third one is the early part of the distal convoluted tubule, which is where the thiazide work. And we also have potassium sparing diuretics which work at the collecting tube and the late distal tubule. After discussing the physiology and anatomy of the nephron, let's come to the carbonic anhydrase inhibitor, which is the first class of the diuretics, and these includes the acetazolamide, darzolamide and brenzolamide. Note that they have a common ending zolamide. Coming to the mechanism of action of carbonic anhydrase inhibitors. So first we will look at the physiology and then we will look at the pharmacology. Let's suppose this is a cell taking from the cells of the proximal convoluted tubule. This is the tubular side, the tubular lumen, where the filtered fluid is passing, and this is the interstitial fluid. This is the basolateral side and this is the luminal side of the cell. Okay, at the luminal side of the cell we have this counter transporter, which transports sodium to the inside and hydrogen to the outside. On the basolateral surface we have this pump, sodium potassium pump, which pumps Na to the interstitial fluid and which pumps the potassium inside the PCT cell. There are also channels for the bicarbonate ion. Okay, so now when there is bicarbonate in the filtered fluid, then this bicarbonate can't be absorbed directly into the cell. So first it will combine with this hydrogen ion, this hydrogen ion was provided by this sodium hydrogen counter transporter, which transport one sodium inside and one hydrogen outside. So this bicarbonate will combine with hydrogen ion to form carbonic acid H2CO3. Again, this H2CO3 can't be absorbed through this membrane. So further, through the carbonic anhydrase enzyme, it will be converted into water and carbon dioxide. Water and carbon dioxide are readily absorbable through this membrane inside the cell. Inside the cell, again, they will combine through the carbonic anhydrase and it will form the carbonic acid again, which will dissociate again into hydrogen and bicarbonate ion. The bicarbonate ion formed thus will will be absorbed to the interstitial fluid through its channels, and the hydrogen ion formed will be thrown back to the lumen through this sodium hydrogen pump. Okay, hence we have absorbed the bicarbonate ion to the interstitial fluid in an indirect manner. Okay, now come to the pharmacology. As we know that this carbonic anhydrase inhibitor is responsible for the conversion of this carbonic acid to H2O and CO2. So carbonic anhydrase inhibitor will basically inhibit this enzyme. So when it inhibits this enzyme, there will be no hydrogen available inside the cell for the function of this pump. We should note this point that if the sodium or hydrogen, any one of these elements is in decreased proportion, then this pump will not work. So by inhibiting this enzyme, actually we are decreasing the transport of these substances inside, and we are basically decreasing the amount of hydrogen ions, so the work of this pump will be decreased and no hydrogen will be available to form the carbonic acid. So the sodium will not be absorbed, it will also be lost, and bicarbonate will also be lost.